History Haters Anonymous.
How to spot 7 fake injuries of the Civil War from a real medical manual. Number 1, genuine deafness is invariably attended by a peculiar listless state of the countenance, with more or less change of the voice. Before a final decision is given, a careful inspection of the ears should be made. The unexpected discharge of a pistol in a case of feigned deafness might suddenly decide the diagnosis. I bet that it will. Number 2, paralysis is frequently imitated, but is generally easily detected simply by watching the patient tickling his feet when he is asleep or threatening him with the hot iron, the carrot, and the stick. Number 3, disease of the scrotum and testicle may be excited by inflation of the parts with air. Don't even know how that works. All such tricks are usually readily detected by the medical officer and his assistants. Dude, that's not supposed to be inflated. Number 4, incontinence of urine, bloody urine, and stone in the bladder have all been simulated by designing soldiers. Harsh remedies are the best means of relief. Fictitious cases of incontinence have been successfully treated by the cold bath or by prescribing a few lashes on the loins, with the avowed object of strengthening the parts. Nurse, put this guy in a cold bath for an hour. If that doesn't work, hit him in the crotch. Number 5, dysentery and diarrhea are occasionally feigned by exciting artificially irritation of the rectum, by mixing blood with the alveolar intestinal evacuations, or by borrowing the discharges of persons actually affected with these diseases. Careful watching of the patient and compelling him to use a close stool will soon remove any doubt. Number 6, feigned epilepsy differs from the real in the absence of lividity of the countenance, the want of froth at the mouth, and the partial character of the convulsions. They don't convulse for real. The pupil does not contract as in the genuine disease. The hand, if opened, is again firmly shut. If you're unconscious, you're not going to shut it back. And the individual often watches with his eye the impression the attack is making upon the bystanders. The application of a heated case knife or of a cloth wrung out of hot water often speedily reveals the imposition. And 7, self-mutilation sometimes amounts to the destruction of an eye, an entire finger, or even the greater portion of the hand. Occasionally it is limited to slight wounds, and the imposition may then be practiced on an extensive scale, as was the case in the French army, in which nearly 3,000 soldiers were slightly injured in the hand, causing the belief that the wounds had been voluntarily inflicted. That hangnail is not going to get you out of the army, sir. History Haters Anonymous. Strike the like, vibe the subscribe.